Away from politics, about 1,200 children under the age of 15 in Ghana are estimated to develop cancer annually, according to the World Health Organization. The survival rate of cancer cases is less than 50% in the African continent, owing to limited expertise and apparatus, enforcing the inequality in child cancer care in Ghana. World Child Cancer Day is actually critically highlighting the essence of early and accurate detection by enhancing the proficiency and expertise of radiologists in interpreting medical images accurately and efficiently. Clinton Yeboah's report.
The survival rate of child cancer in developed continents is peaking at over 70%. This highlights the strides and positive investments in radiology expertise, medical imaging technologies, and early detection methods. Dr. Obed Kojo-Otu, a senior specialist radiologist at Komfo Anokye Teaching Hospital, observed the treatment of cancer, particularly child cancer, is hindered by insufficient equipment and expertise among radiographers and radiologists. This limits the information provided to clinicians for better detection and treatment.
The fact that we should use MRI often for children with eye cancers, which is retinoblastoma. We don't have so many MRI machines in Ghana, so we resort to using CT, and that limits the information we can provide the clinicians so that they'll be able to treat these patients. Training, like we are doing, to improve on our skills, not only us, but those who also image, who are the radiographers, so that we'll get good images that we can interpret for better treatment for the children.
Addressing the gap, World Child Cancer, a charity organization, is acknowledging the limited access to essential imaging services critical in cancer care through the collaborations with the radiology department in Korle Bu and Komfo Anokye Teaching Hospital. Experienced radiologists, radiologic technologists, and other healthcare professionals have been recruited to serve as instructors and mentors for a professional training program for healthcare professionals across the country. Adwoa Aman Boatin-Desu is the country director for World Child Cancer in Ghana. She says the radiology training program will equip radiologists with the necessary skills and knowledge to effectively perform radiologic procedures and interpret image studies to facilitate effective treatment.
When you look at the survival rates of childhood cancer in high-income countries, you can get about 85 to 90%, but in our part of the world, it's less than 50%. It is in view of this that World Child Cancer seeks to change the narrative so that we can get that survival rate compared to the high and income countries that we always seek to be. Early diagnosis, early and accurate diagnosis is key in childhood cancer care and management. So we felt that no, it is very important that we involve radiologists in this aspect because they help us with the imaging and interpretation, among others. So if we should get the correct diagnosis, we are sure of the correct treatment. It will definitely improve treatment outcomes for children diagnosed in cancer.
The training program will arrange for clinical rotations at major training centers to provide trainees with real-world experience in performing and interpreting radiologic examinations. Dr. Obed says the training will help interpret radiological findings accurately and effectively communicate them to the healthcare team. Participants recount the tips acquired will help them include essential information in their reports, which they ordinarily omit.
We have heard from the oncologist and the pediatric oncologist point of view on the things they require from us as images in terms of what they need us to put on the report and how that will affect their management of the patient. So I have learned new tips on how to go about my reporting, what is relevant, what's not relevant, and then the urgency with which they need the reports.
Reporting for Joy News, my name is Clinton Yeboah.